You're listening to Parents You've Got This, the expert guide to parenthood, the complete guide to fertility, pregnancy, birth, baby and parenthood. This podcast is proudly supported by Mistela, a natural origin skincare for babies and children, recommended by healthcare professionals. Mistela by Parents' Side since 1950.
You're listening to the Expert Guide to Parenthood podcast with your host, Christy and Freya. Each week we interview a different expert about a different stage of the parenting journey, and today we're going to be talking all about vaccinations and immune systems.
We have Paediatric Infectious Disease Specialist Dr Linny Kimly Phuong here to talk to us all about what we can expect with our little ones. Thank you so much for joining us today.
Thanks for having me.
So, Linny, it's fascinating how when we become parents, all of a sudden we realise these gaps in our knowledge about things that are so important. Can we start by talking about our immune systems and how they work?
Absolutely. So with the immune system, I think it's important for parents to realise that there's two sort of main parts. And just to put it really simply, you've got what we call an innate immune system, which is just the protective barriers that essentially protect our bodies from things coming in. And then there's the adaptive immune system, which is the more complex part, which is the part that generates memory. So lots of white cells circulating, get exposed to something, and then once they've seen it, they remember it for next time.
So how does our immunity work then? How does it build up?
Yeah, absolutely. So essentially when you are exposed to something for the first time, you are essentially, your body's seeing it, it's processing it, and then it will either remember it for next time if it's the adaptive immune system, or it'll try and get rid of it essentially when it's, trying to eject what it doesn't want. And so the immune system really is around, just protecting our body, keeping things out.
So all of that said, how do vaccinations work then in the scheme of things?
Yeah, of course. So vaccines are training the immune system. So vaccines are really good in that they are often little parts of bacteria or viruses. It shows the body what it's trying to protect against, and then your body, as I mentioned before, processes what it's seen and then generates that memory for next time. So that the next time you're actually exposed to the disease, your body is ready to fight it, and it fights it a lot quicker and is able to get rid of it quicker so that you aren't developing those potential complications.
One of the things you discover when you become a parent is that there's actually a vaccine schedule for your little one. Can you talk to us about what's involved in a vaccine schedule?
Yeah, of course. So I think the first thing to realise is that the vaccine schedule is very well thought out, and it's Australian based. So in different countries, there'll be a different schedule with different timing for vaccines and different diseases potentially covered. So in Australia, we start with sort of the 6 week, then the 4 month, then the 6 month, 12 month, 18 month, 4 years, vice versa. Essentially, with the timing of these vaccines, there's a little bit of thought behind when vaccines are given, according to when a baby loses their protection from mum. So during pregnancy, particularly during that third trimester, there is the transfer of antibodies from mum to baby. And so what we want with vaccines is for that protection to have decreased enough that the baby's producing its own antibodies so that, it can protect itself. But also the timing is around when the disease is most likely to affect baby and the infant as they grow up. So there's a bit of this and a bit of that. And and certainly that's sort of where the schedule comes in.
So can you talk a little bit about what the vaccines are for at the different stages?
Yeah, of course.
And some of them are delivered by syringes, aren't they? And others are
Yes.
syrup. Can you perhaps talk to us a little bit about that?
Yeah, of course. So the vaccine that we initially start with is a 6-part vaccine. So there are 6 components to it. So diphtheria, tetanus, pertussis, hepatitis B, polio and Haemophilus influenzae. So that's the 6 combination vaccine. And I guess what we're protecting against is a lot of different diseases. There are some diseases which essentially are around protecting against meningitis, so brain infection. There are some respiratory illnesses like pertussis or whooping cough, which we've all heard about. And a lot of these diseases you may not see in Australia that commonly anymore, but it's important that we vaccinate against these because obviously there are people that sort of travel in and out of the country. You might be travelling yourself. And so we want to give the baby the best possible protection.
Speaking of whooping cough, there's been a lot of cases of whooping cough lately, hasn't there? And so what do you recommend in regards to vaccine? Do you just stick with the current schedule, or who else gets vaccinated?
Yeah, no, it's a really good question. So I wrote down some numbers for this one because last year, so in 2024, we had a record number of cases. So there were over 57,000 cases of whooping cough in Australia, and that's 23 times the number of cases in the previous year, which was 2,400 cases. So obviously there was a huge surge in cases, and the reason why this vaccine is important is because whooping cough or pertussis is quite infectious, but we know in people who are at risk, they can develop, they can be, at risk of complications. So babies who get whooping cough can get coughing spells, which sometimes can lead to what we call apneas, which is where they have pauses in their breathing. They can have seizures, and it can be fatal. So it's quite a serious disease to protect against. In terms of vaccines, we recommend the schedule as it is for kids. And then other people who should be vaccinated include pregnant mothers. We recommend a vaccine every pregnancy, which I think is often forgotten. We also recommend the vaccine for anyone who's around kids. So it might be the other parent or carers, grandparent carers, people who are working with children, so childcare workers, teachers, for example. And we also recommend it in sort of other at-risk groups, so older individuals, and generally we recommend every sort of 10 years to get a booster.
What about the vaccination for measles, mumps and rubella? It's another one we've been hearing a little bit about in the media recently too.
Yes, there's been quite a few cases of measles at the moment, and there's a huge surge in the US, which is being talked about at the moment. Essentially with measles, it's a vaccine that's given at 12 months and 18 months in Australia. And the reason why we give it at those particular intervals in Australia is because we don't see that much measles in Australia. When kids are travelling though, we can give it as early as 6 months. So for that early protection, but they will still require the 12 and 18 month vaccines. I think what people need to know about the measles vaccine is it's a live vaccine, so it's slightly different to some of the other vaccines. And because it's live, it does, when given at the right time, give that longer lasting protection. And it's one of those vaccines that, again, like a lot of people say that they don't need because we don't see it much anymore, but we are starting to see some cases. And it's one of those viruses that is highly contagious. So we know that people who, if you're not vaccinated, 90% of people will get the disease because it's so infectious. So it's a really important one, and it can lead to complications like brain swelling. So big one.
And that makes me think about all the people that say, I don't need to get vaccinated because that doesn't around anymore, but it's not around anymore because we get vaccinated.
That's right, exactly. Yeah, I think, it's one of those things we talk about vaccination being the victim of its own success.
Yeah.
And so, people sort of think that things aren't as relevant anymore, and that's where people start talking more about the side effects because they don't see the disease so much. And that's one of those things that often we have to speak to our parents and carers about.
Want some extra tips to help you navigate parenthood? Join a Parents You've Got This masterclass. Visit www.parentsyouvegotthis.com.au and sign up for a masterclass today.
So there's quite a few vaccines that aren't on the schedule, but GPs or vaccine specialists recommend. Can you talk about those and why parents would consider getting their kids vaccinated?
Yeah, definitely. So the big one for me that I often talk about is meningococcal B. So meningococcal B is funded in some states, not all in Australia. And the reason why it's an important vaccine is meningococcus it's a bacteria. It causes really severe disease. It can cause brain infection. It can be fatal. I think the fatality rate's 5 to 10% in Australia. So it's one of those ones that's really important. In terms of the meningococcal B vaccine, it is at a cost, which is perhaps sometimes prohibitive to some parents. So I think it's one that if you feel like you are at risk, it's a good one to have. The other vaccines that we generally talk about are the second dose of chickenpox vaccine, which is quite important for that long-lasting protection. And then there are other sort of vaccines like the flu vaccine, which we recommend every year because the flu virus is mutating every year, and so it's important to keep on top of that. And then COVID vaccines with, obviously with boosters in those over 18 or those who are immunocompromised. And then the other big one that we see a lot of is BCG and the other travel vaccines. So depending on where you're travelling, it's worth speaking to your healthcare provider about, where you're going and what diseases are, circulating those areas.
Now, as a mum yourself, what are your big tips for parents who are getting their child vaccinated at different stages?
Yes.
And also, if we can talk a little bit about the delivery of the vaccine, whether it's an injection or syrup, and how that works.
Yeah, of course. I think in terms of planning vaccination, planning is so important when you have a child, particularly one who is a little bit more afraid of needles. And I've got a 5-year-old who essentially will run laps around the clinic, so quite challenging at times. I think planning is really important in terms of thinking about, where you're going to get vaccinated firstly, because a GP clinic might be a lot more appropriate than a public sort of council-run clinic. Sometimes that just takes the edge off. Similarly, with older kids who might be getting their school vaccines, again, you might want to consider having them in your GP clinic. The other thing around planning is, depending on the age of your child, it might be appropriate to speak to your child about getting the vaccine. And I guess thinking about talking to them about what the benefits are. You're getting protected so that we can go overseas, or we can have that trip, or we can do that thing, or you can worry less when you're walking around in the community. So I think that's important. When you're at the clinic or having the vaccine, I think there are a few things to think about. So I would always think about taking some sort of distraction, whether it's the iPad. So yes, screen time is sometimes appropriate. A book or a toy or a blanket or something that kind of comforts the child. Some kids benefit from some distraction sort of techniques, including there's a buzzy bee that we use in one of our clinics. Some kids have an ice pack over there, over the arm that they're going to get vaccinated just for that sort of numbing effect. And then other children also use the the anaesthetic little creams as well, so numbing creams over their arm. So thinking ahead is really, really important. When you're at the clinic and getting the vaccine, positioning is really important, particularly for young kids. So I think my advice to parents and carers is to, I guess you kind of got to be cruel to be kind. You've literally got to hold your kid in a good position so that the nurse immuniser can give the vaccine really quickly and swiftly, and it's all safe and done, and it's it's over before you know it. Because when they're wriggling around, it kind of adds to the pain. Everything kind of gets a bit worse when that happens. And then afterwards, I think it's probably quite appropriate to give your kid a bit of a reward. Yeah. So maybe for the younger kid it's a breastfeed or a bottle feed, but maybe for the older kid they get to pick something that they want to do, or something small that they want to purchase.
Yeah, beautiful. Because I think too, it's it can be so distressing for parents seeing your child in that sort of state of distress.
Absolutely.
So, as a mum, how do you do that with your little one who is so active and, not wanting to? How do you physically sort of hold them? Because I've been in situations where, your children are writhing off you. And it just exacerbates the whole situation, doesn't it?
So we've, we, for our annual flu vaccine, last year had 3 attempts. So, and we would never force her, and that's not the aim of the game. And I think that would be quite traumatic. Yeah. And so what we did the first time was we brought along some friends, and they thought, we'll get the vaccine at the same time. And she went, no, I'm not quite ready. The second time around, we came again, and we came at a quieter time, and we thought that would work. And she just still wasn't ready. And then the third time round, we came with her cousins, and her cousins were quite needle phobic as well. But because they sort of, they were brave and strong, and they just sat there and they were like, oh, that wasn't so bad. She went, oh, okay, well, I'll have a go. And she just sat there, and, we literally gave her a firm hold. Yeah. And once it was over, she essentially said to us, oh, that wasn't so bad. So I think the other thing that's really important is not tricking your child. I was involved in a vaccine clinic during COVID where parents were, I guess, tricking their children into coming to the hospital or the clinic for their vaccine, and that's probably one of the not so good things to do, because you don't want to traumatize your child. You want your child to sort of walk in and go, oh, that was okay, and then hopefully come back for something in the future.
Yeah, that's right. It's going to hurt, but you're going to be okay.
Exactly, yeah, and that's a really good line as well. It might pinch, it might be a sharp pinch or a sharp scratch, and then it's over.
Yeah. Yep. And so our final question would be around signs that your child's having a reaction.
Yeah.
What are you looking out for that my child's having a reaction, and then if they are, what do you do?
Yeah, no, that's a really good question. So there are different types of reactions. So the first thing is, the most common reaction is a local reaction at the site of injection. So often, some kids might get some redness or swelling or a lump at the site of injection. So that's something to look out for. In terms of kind of more systemic reactions, some kids get a mild fever. And then there are sort of more severe and rare side effects like becoming floppy or getting a rash in terms of facial swelling or a full body rash. So if that was to happen, then you would need to get medical attention. And often this is why we ask parents and carers to stay behind after their vaccination. So often within the first 15 minutes, if something serious happens, generally it does happen quite quickly after the vaccine. To reassure parents, there are actually clinics where if a child has had a previous reaction before, they're often seen by someone like myself and talk through, what potentially was the cause of that reaction. And then often we will do a second or third vaccine under sort of supervision to make sure that nothing like that happens again. But yeah, certainly these side effects are super, super rare. Most kids get away with just, a little bit of redness and soreness at the arm and generally are pretty good.
So should you preempt that your child is going to potentially have a reaction and give them Panadol or something prior to going in, or is that a bad idea?
It's not a bad idea, but certainly it's the only vaccine that we recommend Panadol beforehand is the Bexsero or the meningococcal B vaccine, and that's because we know that it is associated with the higher risk of having a fever. Certainly if your child feels a little bit of discomfort afterwards, that you can give some Panadol afterwards to make them feel a little bit better. I think it's, I wouldn't give it before otherwise per se, but yeah.
Oh, fantastic. Thank you so much, Linny, for sharing that expertise with everybody today. I think, the takeout is that it's just so important to do it. Don't trick your child.
Yes.
It's all going to be okay.
Absolutely.
And they can go out and adventure.
They can do whatever they want.
Exactly. Yeah, absolutely. Well, thank you very much for your time.
Pleasure. Thank you.
A huge thanks to Mistela for sponsoring this episode. When we become parents, we welcome any tips and tricks that can make our lives easier. With Mistela's skincare range, you can have peace of mind knowing that each product is specially formulated to be suitable from birth for babies and children. Each Mistela product undergoes 450 safety tests and measures and is dermatologist and paediatrician tested. Mistela is our family's favourite.
You've been listening to the Expert Guide to Parenthood podcast. Never forget, parents, you've got this.
Join a Parents You've Got This masterclass today to be prepared, excited and educated for pregnancy, birth, baby and parenthood. Visit www.parentsyou'vegotthis.com.au and sign up for a masterclass today.
The information provided in this podcast is general in nature and is intended to support, not replace, a discussion with your doctor or healthcare professional. Parents You've Got This take no responsibility for any medical decisions made by individuals based on the information provided in this podcast.